So we'll move to our final speaker of the session, who's Matt Vander Heiden, who's the Lester Wolff Professor of Molecular Biology, but more importantly is the director of the Koch Institute. As Richard Hines and Phil Sharp can attest, as you're transitioning out of these roles, there's a little anxiety as to what will happen next under the leadership of the next individual in charge. I had no such anxiety because Matt Vander Heiden was taking over for me, and now a year plus into his tenure as the director of the Koch Institute, he's doing a fabulous job, including hiring a cadre of outstanding young investigators who you'll be hearing from at least a couple of later today, but also sort of charting a new course for the Koch Institute in the decade ahead. Matt received his MD and PhD training from the University of Chicago, and then he did his residency and internship and fellowship training in the Boston area at the MGH Dana-Farber, and worked with Luke Cantley, where he began to focus on cancer metabolism. And that really has now become his focus, and he is indeed one of the nation's leading voices on cancer metabolism. As I said, he also has the responsibility now of thinking about how the Koch Institute will impact cancer research, not just for MIT, but for the nation and for the world. And we're off to a fantastic start under Matt's leadership. So he's going to tell us now about thinking differently, making the improbable possible in a new era. Matt.
Thank you so much, Tyler. I'm glad to hear that you don't have any anxiety about my leadership over the last, going forward, taking over for you. But in all seriousness, I want to thank you for the introduction. I'm very excited to be here today and celebrate the last 10 years of the Koch Institute and look forward, and I'm particularly honored to speak in the same session as Ned Sharpless and Francis Collins, and I thank both of you for your time and sharing your wisdom with us today. So at the Kresge Auditorium's dedication ceremony 67 years ago, Aaron Copland's Canticle of Freedom filled these acoustically perfect chambers. Commissioned especially for the occasion, the music dipped and soared, not unlike the structure itself. Architect Eero Saarinen, who designed the Dulles Airport and the Gateway Arch, believed that a building should evoke emotion and expression. Such was the extent of visionaries in cancer research who saw the possibilities of opening a cancer center in a 100-year-old cancer factory almost 50 years ago. And then a decade ago, the Koch Institute was designed to spark endless curiosity and innovation, to become what Susan Hockfield has called home to a creative intensity that has not been encountered in many other places on Earth. In celebrating the Koch's 10th anniversary, for the story's sake, I'd like to say that it took a decade to get where we are today, but in reality, it did not. From the beginning, the Institute showed its potential for collaborative research. The thesis that Susan Hockfield and Tyler Jacks and others proposed was bold and brilliant and posed this question: what if we bring cancer biologists and chemists together with engineers, computer scientists, clinicians, and together we dig deep into the hardest problems in cancer? What if these multi-point connections could help us solve those mysteries faster? What if, by developing new insights, tools, and technologies together, we could improve how we diagnose, treat, and as we just heard, perhaps even prevent cancer altogether? MIT had an established regional advantage. We're surrounded by amazing hospitals, biotech and pharma companies, and a thriving investor capital community. We also have a critical mass of some of the best scientific minds in the world who are dedicated to translating discoveries into treatments. Understanding this, the Institute's architects designed an ecosystem that would deliberately cause what we like to think of as collision science. In our building on 500 Main Street, with our wide open entrance, interactive spaces, lone stairwell, and one elevator bank, everyone in the building is bound to run into each other, and in fact, they do. Chance encounters and random conversations on coffee breaks have led to numerous significant breakthroughs over the years by the 500 or so researchers in our many labs, themselves that are commingled on each of our 7 floors. Later today, you'll hear from many of our Institute alumni, including my former PhD student, Sean Davidson. Sean's work is a tremendous example of how things tend to get done at the Koch Institute. As a biology graduate student, Sean worked with MIT engineers to build a device that helped exchange the plasma component of blood in a mouse, and he did this in order to deliver labeled proteins to mice and assess whether protein could act as a fuel source for pancreatic cancer. Well, it turned out it was, and this led into new insights into the disease. But then one day in the Koch Cafe lunch line, Tyler Jacks and Scott Manalis, 2 of our faculty, wondered aloud if such an approach could be used to study circulating tumor cells in real time. Well, yes, it turned out that it could. His novel and innovative approach could be tweaked to do that, and the results of this project, whose promise continues today, provide a powerful and unprecedented view into how circulating cancer cells contribute to metastasis and cancer progression. It's just one example of how worlds colliding within the Institute can set spark to a flame in all the best ways. Who knew that seizing opportunities to advance cancer treatment over a tuna sandwich could have such a big impact? Susan Hockfield and Tyler Jacks did, but others did too, and here we are today. Setting aside the pride of individual inventorship, making discoveries and building tools that can have the greatest impact on patient survival and improve quality of lives. Over the past 10 years, we've seen incredible advances in science and human health that we couldn't have foreseen, even as optimistic as we all were 10 years ago in 2011. But we have so much work to do. Here, science is driven by trainees who dream of discovering solutions that could change the world one patient at a time. And let's face it, when they're not jaded yet, nothing is really impossible. As we know, basic science discovery is curiosity-driven. We encourage our trainees to take risks, question everything, and pursue the most promising leads. They begin with pure curiosity, asking important questions about how biology works and how these things are repurposed in cancer. And when they get to the hard questions, our trainees are free to challenge the dogma and follow where the science leads them. Then, when they recognize the potential value of their discoveries for patients, they also appreciate that it is the imperative to get those discoveries out of the labs, into the hands of clinical trialists, investment partners, and others who can develop and deliver them to patients whose time, unfortunately, may be running out. Discover, develop, and deliver. Prevent, diagnose, and cure. It's a continuum, a virtuous cycle. If we do it right and consistently, we can make a big difference. In our second decade and beyond, our mission is the same. We need to spare more suffering and save more lives. The World Health Organization projects that by 2035, the world could see 24 million new cancer cases and 14.5 million cancer-related deaths every single year. So we need to discover more, course correct, and speed the process by failing fast and falling forward. It can be said that the difference between science fiction and science is timing, and likewise, we are at the frontiers of what we know. We need to push the boundaries of our knowledge to solve real problems for real people. And in my opinion, we can begin to turn the improbable into the very real possibilities by taking action in 4 specific areas. First, we need to think differently. We need to be more open-minded than ever to uncover novel strategies for the future. As many of you know, the Koch Institute focuses on 5 strategic pillars that apply across a broad range of cancers. These pillars are nanotechnology-based drugs, detection and monitoring, metastasis, precision medicine, and immunology and immunotherapy. I propose that we work towards a 6th pillar. We need to better apply computational biology and machine learning to solve the biggest problems in cancer. Computation can draw conclusions that we humans simply cannot. This affords many opportunities that were previously not open to us. We need to apply computation and big data to healthcare including the development of tools to integrate across all areas and drive new approaches and new insights. We need to incorporate information to solve for what we do not yet know, such as the influence of diet or other environmental factors on cancer, and understand why it is that cancer recurs. At MIT, we need to be the leaders in artificial intelligence. For example, to understand the link between environment and disease. Perhaps you could input 50 or more things from our physical world that might contribute to cancer risk and progression, and narrow them down to exactly what's relevant to a particular patient. We've learned that we can help diagnose breast cancer using algorithms trained to see patterns among thousands of images. We're finding that you can predict responses to immunotherapies using AI techniques that can identify which cell surface peptides produced by cancer cells are best recognized by the immune system. That we can use natural language processing and data analytics to sift through countless bytes of information in pathology reports and medical literature and extract valuable outcomes quickly. All of this is happening while the accumulation of data and knowledge becomes exponential by the minute. So how can we work together to integrate all of this data? And how do we use it to solve the biggest problems? Well, there's a school of thought out there that better social processes are possible in science, processes that can uncover hidden potential for discovery. It asks, how can we create a world in which science rapidly and routinely improves through social processes? A quantum physicist and proponent of open science, Michael Nielsen, has called for scientists to embrace new tools for collective intelligence that enable the discoveries to happen at the speed of Twitter. I actually don't think that's realistic, but applying machine learning to a repository of unfound solutions can and will change the face of cancer research. Now, second, we need new funding models to increase the pace of research. The pandemic, increase in fuel and food prices, and the far-reaching effects of war and social unrest have far-reaching implications, including on investor confidence. At the same time, it's no longer sustainable to run a lab on traditional funding cycles and implicit priorities. Our signature research programs aimed at high-reward projects and the most complex challenges in cancer research. Yet many cancers with higher mortality rates and higher incidence remain underfunded. Our ongoing collaborations with industry and academic medical centers keep our research grounded in the issues that impact patients most. Yes, the world is focused on short-term results, but that doesn't mean we can't build a pipeline for the future and capitalize on a new way of thinking to understand what we need to do in terms of investing in that future. Fortunately, we're lucky to have the very best minds working on biomedical innovation. And my optimism is rooted in a firm belief that funding is easier when you have great people who can become almost catalytic mixing bowls, bringing new ideas and solutions, even in the most casual situations, like waiting for the elevator. A notable anecdote is that of Dragonfly Therapeutics. It was started by our own founding director, Tyler Jacks. And Dragonfly is funded not by VCs, but by a small group of family offices. Dragonfly's strategy came about during a conversation between old friends at opening day at Fenway Park in 2015. Those old friends happened to be experts in genetics, biology, and technology, and I would be fascinated to know whether any Red Sox fans in the adjacent seats overheard that groundbreaking discussion and perhaps became investors themselves. Today, Dragonfly remains a hotbed of innovation in developing therapies that stimulate immune responses against cancer. Other examples include the Bridge Project, a collaboration between the Koch Institute and the Dana-Farber Harvard Cancer Center. The Bridge Project brings together cancer researchers and bioengineers from the Koch Institute and MIT with Harvard scientists and oncologists to address problems and bring us closer to patients in clinical research as well as cancer care. These cross-disciplinary, multi-investigator, cross-institutional research teams address unmet needs as they move things closer to patients themselves. Yet another example is the Breakthrough Cancer Collaborative. This has been publicly applauded by President Biden himself, and it's an example of our institute writ large on the world stage. Our Breakthrough Cancer Center partners are scientists, researchers, and physicians at Dana-Farber, Johns Hopkins, MD Anderson, and Memorial Sloan Kettering. All of them top clinical centers that treat cancer, and our shared goal is to find potential cures for extremely challenging cancers, including pancreas, ovarian, glioblastoma, and acute myelogenous leukemia. The shared discoveries could lead to a future foundational collaborations with industry leaders in pharma and biotech, and these collaborations and conversations among fundamental scientists, engineers, and clinicians will continue, and smart investors will always capitalize on the right opportunities. I would say to those of you out there who are in industry, partner with us on innovation. Use us. Play to our strengths. Build in the cost of failure and understand that creativity does not work on a timeline. In the meantime, we won't stop providing the tools, opportunities, and freedom to explore in an area of constrained resources and hopefully change the face of cancer research. Now, third, we need more diversity in research. Biology does not care if you are rich or poor. We know that there are scores of underrepresented people out there when it comes to who does the research and who should be included in research trials and treatments. Unfortunately, this is not a new challenge. There are long-standing difficulties in helping all groups that reflect society at large. For clinical trials, these issues include language and cultural barriers, having to miss work and forfeit pay, limited access to childcare and transportation, and simply living far from and under the radar of research facilities. Overall, these represent missed opportunities in cancer research, as disparate racial and social economic groups experience disease and respond to treatments differently. These geographically, economically, and socially disadvantaged patients, however, may hold keys to unlocking what we don't know, and we need that data, and importantly, we need to use it responsibly. Access to new treatments has to better reflect all populations, because we will do well when we can do a better job with diversity and inclusion. Now, fourth, we need to identify barriers to progress. Isaac Newton famously said, "If I have seen further, it's by standing on the shoulders of giants." Now, we've stood on those shoulders, and now we find ourselves at the forefront of what has yet to be solved and in control of realizing the promises of the past. So let's go there, but let's face some truths. We can't afford to continue to attack cancer incrementally. We have to take more risks. We're not going to change the world otherwise. When you think about it, the stakes aren't enormously high because we know that the business will test everything countless times anyway. We know that science in the end equals failure, so we can all agree that it's okay if we're not always right. If we're right 5% of the time, we'll make tremendous progress. We don't take enough credit for what works, often because we can't answer why it works. If 1 in 10 breast cancer patients responds to a treatment, we may not know why, nor why the other 9 did not. And this is simply not acceptable. We cannot keep doing more of the same. Going forward, we have to challenge the status quo and ask the hard questions. Should we all be more self-critical? Are we among the barriers that have to be overcome? Are we too rigid in our thinking? Are we missing or overlooking things by adhering to conventional wisdom in science that we haven't ourselves truly challenged? Are we being as aggressive as we can? Should we be more entrepreneurial? Should we be more flexible with respect to intellectual property? Are our research projects nimble enough? Are we doing enough to fill the pipeline of promising young scientists? Are we too quick to abandon projects? Or conversely, are we staying with bad ideas for too long? Are we too dismissive of the uncredentialed? And are we going to enough Red Sox games and eating enough lunches together to provoke these trailblazing conversations? What else should we be asking to advance from fundamental discoveries to real solutions? At the end of the day, what success looks like is what we hope will be our legacy. And it all comes down to one thing: people getting better. People getting better. Over the next years, we will be honored, humbled, privileged, fueled by passion and purpose to make that so. And thank you all so much for being on this journey with us.
Thank you, Matt. That was great. We now have a coffee break, which will be outdoors. There's tents set up in the back. Our next session scheduled to start at 11. Please do get in your seats by 11 so that we can get underway. And for those of you who don't know, there are bathrooms basically just below us on the floor below. So we'll see you back soon. Thank you.